Back in 1981, just after graduating from high school at the age of 18, my father, Nelson Velonza, got his first and last full-time job at Swedish Medical Center.
To this date, he is still working there, making it over 30 years since he first got his job. Swedish Medical Center is a hospital in Seattle founded in 1910 and is considered one of the most historic hospitals in Washington. There are 3 different locations of Swedish Medical Center in Seattle, and my father works at the Cherry Hill campus. His job is classified as a facilities engineer. What is a facilities engineer, you may ask? Well, it is closely related to the more known maintenance worker. Most of the time he does electrical and plumbing jobs. During the day, if he does not have another job that he has to do, he carries around a pager so that he can be notified if there's anything he needs to do around the hospital. A certain job that he has to do is called a room PM. This is when he and other people are assigned to a room to inspect and make sure the room is perfect for the patient. The facility engineer, painter, and carpenter have the first job for the room. Usually, the facilities engineer must check all the outlets, the sink, the toilet, and all of the lights to make sure everything is functioning correctly. The painter and the carpenter are there just to make sure that the room looks good for the patient.
After the facilities engineer, painter, and carpenter does their job, the clinical engineer will then come in to inspect all of the technology of the room. This includes checking the television to see if it works properly. Another job a facilities engineer must do every now and then is ordering the oxygen and nitrogen tanks needed for the surgeries. This is important because without the oxygen, some patients may not be able to live. Hospitals are pretty big places, and a facilities engineer must go around most of the hospital just to do their jobs. To save time, they get access to these special tunnels which connect to most of the places in the hospital. This makes it easy for them to get around the hospital, so they can do whatever they need to do at any place. This job is very unique, as most of the time you are not told what to do. You just check a program on the computer for what task you must complete, and that could be your whole day. There is a supervisor though, but usually all he does is watches over everyone. I asked my father, what are the best and worst parts about your job? And he said, the good thing about it is the flexibility, meaning you can do your jobs in any order or any way. But the bad parts is that some of the jobs can be pretty dirty, like cleaning out the sink. Facilities engineers do some of the most important jobs for the hospital. And although they may not need as much training as a doctor would, they are just as important for keeping the patient safe and happy. Another good thing about this job is that there is leeway for a lot of things, such as breaks and lunch. It is scheduled, but you may be busy come lunchtime, so you can take breaks whenever, as long as it's the right amount of time. Sanitation also seems to be very important. As a facilities engineer, your hands can become very dirty easily, so before entering a room, it is required to use hand sanitizer so you don't contaminate anything. Experience with the electrical work and the plumbing is important. For example, you won't be much of a help if you don't know how to fix the lights. The lights can be confusing because there's a lot of cords that you have to use. Learning about my father's job was very interesting. I learned that being a facilities engineer can require a lot of hands-on work, but can be really rewarding because of the flexibility and the pay. I have not figured out what I want to do for a living when I grow up, but after visiting my father's work, I consider working as an engineer one of my options. The job seems very rewarding for the work you have to do. It doesn't seem as boring as other jobs. From my visit to Swedish Medical Center, I learned that although my father's job can be really dirty at times, it was also very entertaining watching my father fix all of the different things around the hospital. School isn't required to become a facilities engineer, but there are colleges recommended for getting the experience which will help you become a better engineer. The top 10 colleges recommended to go to become a facilities engineer are the California Institute of Technology, Carnegie Mellon University, Cornell University, the Georgia Institute of Technology, the Massachusetts Institute of Technology, Purdue University, Stanford University, the University of California,
the University of Michigan, and finally, the University of Illinois.